I'd like to call to order the Health and Human Services and Aging Committee, Wednesday, May 16th, 2018. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Hauser. Here. Ms. Baker. Here. Ms. Brown. Ms. Brown is absent at the moment. Mr. Miller.
Here.
We have a quorum. Let the record reflect that Councilwoman Simon is also in attendance.
All right. Anyone signed in for public comment?
Yes. Ms. Walker Brown.
Good afternoon.
Looks like the road is shortening a little bit. It's just that, I'm still a little confused, but I guess it's gonna take the expert panel to give me this. I'm still looking for the termination of the facilitator, the supervisor, the caseworker, and or the case specialist dealing with Anaya Day Garrett's case. Also, I want to bring to your attention, I understand today witnesses, we only have 3 minutes to speak because it's the regular meeting. Next week, there'll be a lady, a concerned mother, whose child was taken from her by Child Protective Services and given to her, the baby's father, who's allegedly the abuser, and then the baby was put in foster care and was sexually assaulted. So I'm going to have her come next week because I think you need to hear her testimony. Because right now I know we fight for Anaya and Tanasia McLeod and Jordan Rodriguez, but we have to fight for this baby that's still alive and that's being abused and neglected, and the system has failed her because she's failed through the cracks. So I want to thank you for having this hearing, but the fact that testimonies can't be over 3 minutes, you know, I'm in a little conflict with that, but it's your hearing, and I thank you for having it. But next week, I'm going to come with some key players that you need to listen to because there's still children falling through the cracks.
Thank you. Is there anyone else?
Yes, Ms. Liu.
Good afternoon.
Good afternoon.
Well, yesterday I came here, I talked about what happened to the shelter after we finally got service provider changed. But the problem with the homeless shelter systems, and right now, whatever we will have here today, is about the same. All the service, whatever model they want to use, all these things were designed by the people who didn't need this type of service. So how much they can actually understand the depth of it, the things will get involved into it. We are talking about health and human services, not parcels, not packages. However, here, not just those people fall in the crack of the system. Same thing for the homeless people. For example, I think Ms. Miller probably received an email. It's about HUDs will be changing rules. If that proposal actually passed, our homeless people, that will be double, triple, quadruple, whatever the amount you can imagine. HUD has a proposal right now. They want to increase the percentage for people to receive low-income housing. Instead of 30% of net income, it will be 35% of gross income. Think about all these families. Their child care, health care will not be deductible anymore. So now who can afford to live in any kind of apartment? Same thing, today, another thing, the food stamp program, Mr. Miller also mentioned during the budget hearing last year. Even federal government declared that our recession was over, but actually we have more people, they need government assistance program, no matter what kind. Now, the food stamp program itself will also be cut. Instead of they do the secretly random cutting. You have a disabled senior right now living in an apartment. Her food stamp only actually has about $12. So if all those things happen, don't forget, Medicare, same thing. They want to exclude people. They want you to volunteer to work. But do we have a public transportation to support all these working hour requirements? So that means the potential, the chance for way more people to become homeless. That's huge. We need more shelters. Just like we need a very serious look at current DCFS service to ensure the children actually, they get abused, they will be protected, but not just taken away from parents to putting into another danger. Thank you very much.
Thank you.
Mr. Jones?
My name is Joe Jones. I run a group called Fathers Lives Matter. We're a local group, but now we spread nationwide. The reason why I run that group is because my daughter has been molested. She's been starved. She's been beaten with yardsticks. I've caught 696 kids several times. They haven't done anything about it. I'm in my second custody battle, which is going to be happening in a few days. My daughter was subject to emergency removal, and every single time that she was subject to that removal, they denied to take her out of that home because basically I'm a male. I've been a private police officer for 10 years. I have no criminal record. I have 46 pieces of evidence I'm going to be producing to a court in a matter of 4 days. Your agency failed my child several times. Something needs to be done with 696 kids. They were pre-warned that there was a convicted felon living in the home. Not only did he molest my daughter, he raped an 11-year-old girl and raped a 10-year-old girl outside of the home. It's ridiculous. They were pre-warned about it. They knew he was there. They didn't do a full investigation to get these kids out of there. I was even stripped of my shared parenting plan because the courts thought that I was maliciously making these calls. I made 16 registered calls to 696 kids that something was wrong with my child, and he unsubstantiated it every time. After I lost my shared parenting plan, 2 weeks later, he was charged by Parma Police for rape on a child and molestation of 2 other girls. I was right. 696 kids was wrong. They should have removed my daughter. Currently, she's 10 years old. She was at 49 pounds. I took her to Parma Hospital. They diagnosed her as malnutrition, and they called the police, and they called 696 kids. The worker came to my house and made me feel like I did the most horrible thing about taking my daughter to the hospital, and she told me that she's not going to remove my child because I've already filed for emergency custody. There's too many hands in the pot. So I told her, just let my kids sit over there and starve them. We're now a year later, my kid's still starving. And to date, I still get text messages, even today, telling me, Dad, I'm hungry, I need food. I have to take food over to her all the time. And the police was even calling me a couple of days because I even drove up in front of the house and handed my daughter a Happy Meal because she was so hungry. I mean, so it's the 46 pieces of evidence. They go from her being forced to bury dead animals in a yard with the rotting corpse of an animal sticking out of a yard, and her putting flowers on top of these animals. Her mom and her 12-year-old sister beating each other in the face with their fists. She watches domestic violence all the time. Her 12-year-old sister continuously tries to cut her wrist in front of her. And to date, 696 kids still believe that's a safe environment for my child. There's nothing wrong with me. I've already raised 2 children on my own, and I was granted full custody. My 21-year-old daughter's married. My other son, he's doing beautiful. I had him from birth. I did perfectly fine. There was no reason why they shouldn't have left my child in that home, and they did. It's unacceptable. Thank you.
Thank you. All right. I'd like to open it up for approval of the minutes from the May 2nd, 2018 meeting. Is there a motion? Is there a second? Second. Okay, moved and seconded. All in favor, say aye. Aye. Minutes have been approved from the May 2nd, 2018 meeting. There are no matters referred to the committee. Today we will have presentations from the Department of Children and Family Services. But first I would like to say today are the first of 2 hearings that will discuss circumstances that determine the removal of a child. Please keep in mind that the decision that determined the removal of a child, please keep in mind that the decision to remove a child from their home is ultimately determined by a court order. So you will be hearing from a host of experts and professionals who work in this field every day and who are responsible for making those decisions. Protecting children is a collaborative effort that involves key professionals from many different agencies and organizations. Therefore, the goal of these hearings is not only to look at the collaboration of our decision-making and how we can make those processes more effective, but to also provide the public with a better understanding of how the child welfare system works and how we all, even at the reporting level, should be held accountable for protecting the lives of our most vulnerable population. However, I would like to share with you this committee's effort to review procedures as it relates to the removal of children from their homes and examine ways we may be able to add additional resources and make recommendations regarding the implementation of more sound protocols to help circumvent tragedies from occurring in the future. In addition, as members of a legislative body which oversees the county budget, it is within council's purview to make recommendations. However, it will be solely up to the administration to take corrective or any disciplinary action. So if we will now start, I believe it will be Director Cindy Weiskettle.
Good afternoon. Thank
Good
you for this
afternoon.
opportunity for my staff and I to come forward and talk a little bit about the practice of the agency, as well as we are going to explain how a family moves through the system. You have a copy of the PowerPoint in front of you. You also have a separate workflow document you might keep in front of you. We will reference it as we move through the presentation. Cuyahoga County is one of the original family-to-family sites from Annie E. Casey. So in the early 1990s, the Annie E. Casey Foundation picked this agency as well as 4 others to pilot what is called family-to-family. The first slide we're looking at is, in fact, how the 4 core strategies of family-to-family work. The idea is that these 4 strategies are linked together. These 4 strategies are linked together and as a collective whole can help move an agency forward. As I said, we were an original family-to-family site. We continue to this day to implement all 4 strategies. The strategies are as follows. Building community partnership. So we have had collaborative relationships with community partner agencies for over 20 years. These collaborative agencies work with us around prevention as well as around supporting families whose children have entered the system. The recruitment, development, and support of resource families is the whole idea of developing resource families, also known as foster families or kin families, to serve as placements for children in their own communities. There is the process of self-evaluation. Self-evaluation means that you use data to drive your practice. We have collected longitudinal data on our families since the 1990s. We use that data when we make decisions around contracts or programming based on what we know about our families. And the 4th strategy is called team decision-making, which is the process we implemented in 1994 around how we make the decision to remove a child. You will hear a little more about team decision-making a little later in the process. The second thing we were asked to comment on was the model shift. So in 2016, after reviewing our data, we made the decision to shift how we manage cases. So what our data told us was, prior to this time, we had intake that did investigations, we had an ongoing unit that picked up voluntary and court-involved families, and then we had an adoption department that dealt with children whose parental rights had been terminated and finding them new families. The model shift came to be because about 30% of our families who moved from intake to ongoing were only open and ongoing for about 90 days, and then they were able to go successfully on without us. The model shift then intake became known as short-term services, and extended services includes what was ongoing and the adoption department. So what happens now is all investigations done by the agency are done by short-term service staff. If the decision is made that a family needs a short-term intervention and the family is voluntarily agreeing to that, that case stays in short-term services. If there is court involvement requested, then the case moves to extended services. And the family will remain in extended services until either children are returned or parental rights are terminated. And frankly, the reason we did this were a couple of reasons. It was the idea that What we know in child welfare is every time a child's case moves to a new worker, you have opportunity for a delay in services. A new set of staff need to meet the family. The family has to continually tell their story. And so this was an opportunity to reduce the amount of times a worker could change to bring continuity to the case. I'm sorry, I'm going the wrong way. Mandated reporters. We were asked to talk a lot about mandated reporters. So mandated reporters is outlined in the ORC. And basically a mandated reporter is somebody acting in an official or professional capacity who knows or has reasonable suspicion to suspect that there is an allegation of abuse or neglect going on with a child. As you can see from the slide, all of the mandated reporters for Ohio are included. And so if you are a mandated reporter and you call the hotline, you can be given a code that you can check back in on the referral that you made on that particular family. We thought we'd start before we went through the workflow with a little overview of the data about our system. So as of May 14th of this year, there are 2,311 children in agency custody. Of those 2,311 children, 524 of them are in permanent custody, which means those are children where parental rights have been terminated, and we are looking for adoptive homes for those 524 families. In addition to those two sets of children, we have 679 children who are under the court's supervision. Those are children still living in their parents' home, but they have been court ordered to engage in certain services to hopefully ensure their children stay with them. Our annual budget is about $142 million, and about $50 million of that money is spent on board and care of children. Staffing levels. So we have 488 positions of frontline child protection specialist workers. Of those positions, 378 of them are people that carry cases. So those are workers that are in short-term extended services. And currently we have 22 vacancies in frontline services. So what I'm going to do is turn the presentation over to my deputy, Tamara Champlin-Wagner. She's going to talk through the call comes into the hotline and what happens.
Good afternoon.
Good afternoon.
So, okay, you have the workflow document. I'm not going to read it step by step. We start at the hotline, the 696 Kids hotline. It's a 24/7, 365 operation. Calls are answered by child protection specialists. All abuse and neglect allegations are screened by those screeners or those child protection specialists, and then the supervisor is ultimately the one who makes the screening decision. In 2017, we received 35,897 calls. Of that, 14,117 were screened in for investigation. 51% of those were physical abuse, 45% were neglect. Screened in referrals are either emergency or non-emergency. Emergencies require a response within 1 hour, non-emergencies within 24 hours. If we are unable to see the child in question, we have to make daily attempts to continue to search for that child. Short-term services, as Cindy described, is where we do investigations as well as provide in-home services for voluntary families that need a short amount of intervention. When a report is screened in, it comes to short-term services and a child protection specialist completes that investigation. We have 45 days to do so. Outwardly, we could go to 60 days if there's additional information or additional contacts we need to make. In short-term services, a family may remain involved with our agency for about 90 days post-investigation. That's a very fluid timeline. It depends on what the family needs. We help them stay connected to services that meet their needs. We link them to their neighborhood collaboratives for services that are close to their home so that they can reach out to them whenever they need. Families in short-term services are usually not court involved. If a court filing is completed, the family transfers to extended services. To give you a sense of caseloads, there's a few point in times here. So we purposely went back to 2015 because that is before the model shift. We started the model shift in the mid of 2016. 2017 is our first year completely in the new model, and then currently at 2018. So when we began in 2015, our average caseload in short-term services was over 20. In 2016, we dropped that down to starting at 16. In 2017, 11.7. And then January of 18, 12.5. We're currently at 16.26. We have seen an increase in calls over the last few months, which has attributed to higher caseload. So Chris Cabot, who is the administrator of our extended services, is going to walk through the next few slides.
Good afternoon.
Good afternoon. And what's your name
My
again?
name is Christopher Cabot. I'm an administrator over Extended
You
Services.
say Cabot.
Yeah, C-A-B-O-T. So as soon as short-term services determines that juvenile court involvement or longer-term services are needed for the family, that's when they contact my department, Extended Services, and we begin to work in tandem with them as soon as possible. You know, it's important that we get involved with any meetings that are held to talk about the potential court involvement. That way, there's a seamless transition from one worker to the other. Cindy talked about the importance of having the least amount of workers as possible, and this is the one time where the transfer does occur. So we want to make sure that all the knowledge is passed on at this one point. You know, additionally, families are sometimes you know, caught off guard when CFS knocks on their door and all of a sudden they have a case involved, and sometimes that initial relationship with the short-term services staff is a little rough, and so we really feel it's important to build the trust, because the extended service workers are often the ones that are going to be involved for the long-term process, not, you know, for just a short amount of time. So the extended services responsibility is basically to work with the children and families towards reunification. This includes making any supportive service referrals for services or for needs identified, monitoring those services, communicating with the service providers, scheduling and monitoring family visitation. It's important that the children and their families maintain as much contact as possible during the time the kids are out of the home. And then ultimately also providing court testimony, whether that court testimony is one that advocates for reunification or potentially a termination of parental rights. Our interactions through visitation and family visit monitoring are critical. They're very vital because, you know, this is in the least family-like settings where we want this to occur, so that when we do testify in court, we can provide the best possible information to help that decision. When we talk about children's services, a lot of people talk about safety, safety, safety. Well, we need to keep in mind that permanency is just as important. Children need a stable home, and they need a stable and permanent home in the shortest amount of time that we can achieve that for them. So that's why, you know, we really need to work towards this stability, reduce the amount of moves a child has. So when we make the decision to either reunify a child, we want to make sure that that is a good decision that is made with a solid foundation, and that the family is wrapped in services so that that children does not need to enter care again. Same thing with when we decide to make a permanency decision for a child. We really want to do our best to make sure that that's going to be the long-term permanent placement for that child, ultimately, so that they never have to re-enter care. Just some statistical numbers for you, as well as similar to what Tammy shared for short-term services, is on the far right. I'll just focus on in 2015, we were averaging 12.6 cases per ongoing worker. We hovered right around that same amount in 2016. As 2017 and the model shift came around, we were down to 11.21. Now, if you look in the middle, right now, we're averaging about 12.2 cases per worker, which is up about almost 2 cases per worker. But as Tammy alluded to, there's been a significant increase in call volume recently, and also, to be quite honestly, we've had some staff turnover, which has led to some cases needing to be reassigned. So those things have impacted our case numbers. But 12 is a manageable number for our staff, we feel, but it does, you know, it is a tough job, and it's tough work for them. At this point, I'm going to turn it over to Jackie McCrae. She's our Deputy Director over case review and our permanency back-end services.
Good afternoon.
Good afternoon.
Since the early 1990s, team decision-making meetings have been the platform utilized by the Division of Children and Family Services to make decisions regarding custody and placement. When there is a question or concern as to whether or not a child can remain safely in their home, a team decision-making meeting is to be convened. And at that meeting, the worker of record or the child protection specialist is to invite all parents, caregivers, support, the entire support network for a family, community partners and other involved professionals who can come to the table, and so that we can actually talk about the presenting situation that's bringing us to the meeting, and also have some discussion around some of the most least restrictive plans that can keep that young person safe. These meetings are facilitated by trained facilitators who are non-case carrying, and they guide the team through 6 distinct stages for that meeting, which does include identification of why everybody is at the table, kind of assessing the situation, and as I alluded to before, coming together to try to make some plans or decisions around what is the least restrictive plan that can keep that child safe. And although the goal of the meeting is to reach consensus, DCFS ultimately maintains responsibility for the final decision-making. The resulting TDM decision becomes the agency's official position, and if the recommendation coming out of the team decision-making meeting recommends removal, then the caseworker meets with the prosecutor's office to begin to complete the appropriate filings for juvenile court. And I'm sorry, I did not change that slide. So just to give you some information in terms of putting some of this into context regarding the volume, in 2017, our facilitators facilitated a total of 3,297 team decision-making meetings where there was conversation regarding that young person remaining safe in their home. That was an average of 275 meetings a month. First quarter 2018, we have had 655 team decision-making meetings. And at this point, I'm going to turn it back over to Director Wise-Kettle to talk about reasonable efforts.
So the law is very clear. When we work with families, we are required to make what is called reasonable efforts. So in situations where families become involved with us, an investigation is completed, and a family is in need of services, we are required to attempt to put those services in the home to try to maintain the child in the home. In situations where kids come into custody, the same rule applies. Before bringing a child into custody, we need to make reasonable efforts to maintain them. Now, there are certainly times where it isn't reasonable to make efforts, and we bring the child in on an emergency basis. So again, the idea of reasonable efforts is either to prevent the removal or to ensure the return of the child to the home as quickly as possible. As part of reasonable efforts, we would turn to our long-term relationships with our collaborative partners. As you all know, we have recently had our contracts approved. We work throughout the entire county with many of our settlement houses, but also with school districts and cities that provide intense support for families, as again, who may be becoming involved with the agency or to prevent their involvement. Today we have with us the incoming Executive Director of Westside Community House, Rochelle Milner. She's going to talk a little bit about the work of the collaboratives.
Good afternoon. As she said, my name is Rochelle Milner, and I am the incoming Executive Director of Westside Community House, beginning July 1st. So we provide an array of services to families in a number of settings within DCFS. For those preventive families, it may come through providing initial assistance. This may be through diapers, access to resources like clothing, utility assistance, where they can find food and other immediate needs that can help them within their families and to help them remain to be intact in the community. We also provide ongoing assessment and services. This is by way of an assessment called the Collaborative Assessment Matrix, where we look at 18 life domains and really measure where these families are to see if they're in crisis or they're stable, to help them establish goals so that they can attain them and move forward and to be able to sustain in the community with their families. I also stated that we provide emergency assistance by way of rent, utilities, and other household items to help families that are going through urgent situations. Once again, looking at prevention. We provide system navigation. So what that looks like for prevention families, it could be with the school, it could be with the court system, it could be with job and family services, and we help the families understand what they need to do to go through those systems and attain whatever it is that they're looking for regarding that prospective system. Resources and referrals go a little bit further to look at services for these children. So they may need a tapestry service for a child with mental health issues, counseling, and other services that can help their families remain. We also provide collaborative engagement and organization. So maintaining relationships with community organizations so that as we engage these families, we can make referrals. So we know that it's about knowing the organizations, but it's also about the relationships that we maintain with these organizations and the staff that they have as well. What that looks like for families who have court order protective supervision includes all of the previous things that I've discussed. But what it goes further into is attendance with the team decision meetings. Our staff have been privileged to be able to attend the trainings that the DCFS workers attend so that we're armed with the information as we go to the meetings with the families and can explain what a SAR is, explain what the different acronyms are and what the process looks like. We can then be able to connect with them in the community where they live so that they can come back and be able to be in a different setting as they learn about the process and be made more comfortable about what they're going through. We receive the referrals from DCFS, and they show us the way that they would like for us to work with the families. Ongoing assessment and planning, once again, we do that through our collaborative assessment, looking at the goals, but with families who have involvement, a lot of times they do align with whatever the initial situation was to get them involved with the Department of Children and Family Services. So sometimes it will line up with parenting skills or education or employment. So we'll really work hard to align our work with the case plan goals to make sure that those families get the needs that they have. We have looking at system navigation once again, so it's really helping the families understand the process, the acronyms, what to do when you go to court and what to expect, et cetera. When we look at being a bridge between the community and the child welfare agency, as I said, we're able to go to the departmental meetings and share information as far as what we see from the community end. It strengthens the relationship and it strengthens the knowledge on both ends when we look at the reciprocity that exists on both levels. And once again, when we think about the collaboratives, we have organizations that work with us to be able to serve these families that we're working with that have open cases with the Department of Children and Family Services. We're really grateful to be able to be involved with this work for over 20 years, and we're looking forward to supporting the work of Children and Family Services in the future. Thank you.
Okay, so I wanted to take a minute and walk you through the child fatality process. The most unfortunate circumstance that we have to deal with is anytime a child dies, it's devastating. And so we have to take a look at what we have done on that case or what kind of environmental factors exist. So internally, we look at any case where a family is currently open or has had activity with our agency within the past 12 months. Our performance evaluation and innovation group review each case to look at policy and practice issues. If the fatality is screened in, our special investigations unit complete the investigation on the fatality. And then our director holds a next day meeting to review that case. And she sits with any staff who've touched that case, our special investigations unit, and goes through the history of that family, the history of that child, the circumstances surrounding the fatality, and looks to see how things could have and should have been done. As you know, we also countywide have a child fatality review committee process. That is shared by the Department of Health, so it is an external group that looks at every child death. They look to really see what kind of systemic issues exist to prevent future child deaths. The board reviews, again, every child that has died in the county. It's a confidential review board. It makes up of multidisciplinary folks. So we sit at the table. We have law enforcement at the table. The medical staff are at the table. The medical examiner's office is at the table. Anybody who may have interviewed or been involved with that child's life, like Help Me Grow, any of those kind of practitioners would be at that table. And then the board makes data-driven recommendations to protect the health and safety of the children in our community. So things like the Safe Sleep campaign would have come out of that kind of fatality review process. Next, we have Leon Harris, who is the deputy over our performance evaluation and innovation, and he'll walk through our CPO.
What's your name, sir?
Good afternoon. My name is Dr. Harris. I'm the Deputy Director of Performance Evaluation and Innovation. And this afternoon, I'll be discussing the Child Protection Oversight and Evaluation System, also known as CPO. CPO, the purpose of CPO is to evaluate and partner with public child servant agencies to ensure that children who are at risk of abuse and neglect, that they receive adequate and timely services. The origins of CPO stem from a 1986 case, Roe versus Staples, where it was argued that Hamilton County did not follow the standard practice of rendering timely and adequate services to their clients. So what happened out of that ruling, there was a consent decree that was required, and over the next 11 years, CPO was developed and ultimately implemented in 1997. Now the protocols of CPO required that public child servant agencies be evaluated every no less frequent than every 18 months. So since 1997 up until now, we've had 10 CPO audits, and we have the 11th one coming up. In the original paperwork or development and planning paperwork for CPO, it was stated that cases would be selected so that statistically reliable information would be generated from those reviews. And it was also stated in the original planning and development paperwork that there would be some type of uniform data collection and documentation procedure across all public child servant agencies across the state of Ohio. Recently, we've had some questions about CPO that have come into our agency, and so my staff has done a comprehensive review of the most recent CPO audits as well as past CPO audits, and what they found is that the methodologies to get to the findings that we are at have not been consistent with the original planning and documentation of CPO. So while there are some concerns with the way that DCFS operates in their practices, they're not scientifically valid in regards to the methodologies of how we've gotten to those actual findings. So as a staff and as leadership in Health and Human Services, we conduct internal reviews to make sure that we're looking at what our practices are on a daily basis. We're looking at data to help see if we need to change practices, if we need to inform different protocols, and if we need to talk about how we may want to provide additional professional development to our staff so that they can provide better service delivery to our clients and so that we can receive better outcomes for our clients. So our recommendation behind the CPO audit is that the state work with public child servant agencies, also with researchers to develop a more formal process that is, I would say, that is more scientific, so that we can come up with conclusions or results that are more accurate and valid and also reliable. And so I think that's it right now for me, so thank you.
So as Tammy said, anytime we have a fatality, we have the opportunity to look at practice. And so this most recent fatality has caused us to look at how we're operating. Are there changes we need to make? So a couple of things that we plan to do going forward. We are going to launch in the end of May what we are calling a community listening tour. So when the protesters came outside our building and, voiced their concerns, it reminded us of the importance of going out to the community on the regular and really hearing what people were worried about, hearing what they thought the agency did, hearing what they thought the agency didn't do, and also taking the time to help educate the community on who we are and who we're not. So as I said, the listening tours will begin May 29th at the Friendly Inn in Central. We also have the opportunity this Saturday. There is a big gathering of daycare providers, and we will be doing some training on being mandated reporters. My understanding, there will be over 100 different daycare providers in attendance, and we will do the training ourselves for those providers so they know what it means to be a mandated reporter and what the expectation is for them. We've also reached out to the schools. We have a very good relationship with most of our school districts. Usually in the fall, usually around August, we get requests to step forward and do mandated reporter training for the schools. And again, that is something we look for. We have a speakers bureau that is ready and able, as well as a multitude of other staff who will step forward and do that. We also are in the process of finalizing our MOU with the police. We have an active memorandum of understanding with all of our county police, and we have recently updated it, and the plan is in June. We have done this before. We invite all of the leadership of the local police stations in, and we go over the plan, we sign the plan. It's a really solid working relationship. I think that's the end of our presentation, unless you have questions for us.
All right. Definitely have questions. It's not that easy. So who would like to go first? Councilwoman Brown.
All right. Thank you. Thank you, Madam Chairwoman, and thank you guys for the presentation. I have quite a few questions, so if I get a little long, Madam Chairwoman, just let me know. I've reached my maximum. But for the first question I have is there was a number of 2,311 cases currently. Is that?
No, that's the number of children in custody.
In custody, is that average, low, or high?
So what I can share with you is that in the early 2000s, 2001, we had over 6,000 children in custody. Then that number started to come down. In 2000, at the end of 2013, there was 1,608 children in custody. The end of 2015, the number had jumped to, 2017, 2,155. So we are definitely on an upswing. Some of that can be attributed to the opioid crisis. Frankly, some of it can be attributed, Tammy and others have referenced, in the first 4 months of this year, we have seen 450 additional referrals screened in than last year. So that is also probably attributed to why we're seeing the rise in custody.
Okay, so of the number of short-term and extended caseworkers that you have, can you break that down? I see you touched on that, 488, 378, and 22. So how does that break
down? There are 143, I believe, short-term service positions. And extended, I'm sorry. 180 positions in extended service. We have about a 5% vacancy rate right now.
Okay, and for daily contacts, when you talked about that, you said if you have to have daily contacts if their child wasn't home during the first visit. How many times does that occur? Is there a limit, or do you just keep going until you actually reach somebody?
What practice actually says is that, law says that if we go out and do not make contact, we have to make 2 additional contacts within 4 days. We say you have to make at least 1 additional contact every day. What I would say to you is by the time we get to the 4th day, overall, we have seen just about everybody. Every family has been contacted. We have a little less than 5% of families under investigation in which we are not able to make contact.
Okay. With regards to the short-term services, what percentage of those are exit within 90 days?
I would say the majority. The majority of families being served in a voluntary case, which is what short-term service would be, the majority of those in 90 days would close in short-term service.
Okay, I'll need you to give me a figure. The transportation that you provide, well, you said that you direct the people to a collaborative or when they're in the short-term services. With the services being declined for public transportation and also the rates going up, and these are already vulnerable and needy families, do we provide transportation to these collaboratives?
So, two things. First of all, many of these collaborators are located right within their neighborhood, so they're able to get there by foot.
Well, we just reduced some of the collaboratives, so,
We also do provide bus tickets.
okay. And per caseworker, can you please explain how this number went from 21 to 16? Is that because what the transition that you guys did where everyone kind of is now taking short-term cases in is, can you touch on that? That's a huge decrease, and I'm referring to the average caseload.
So this is part of the model shift. Prior to the model shift, there were less staff in intake, which is now short-term service.
Okay.
So we increased the number of staff that are in short-term services, which helped to bring the caseloads down.
But so it brought the caseworkers' caseload down because you increased the number of,
Staff doing investigations
But
and
the-
short-term services.
but the cases are still going up.
Yes.
Okay. How many of the, we talked about the 30 days, I think, returning into service, and I wanted to know how many families are being reunified in the short term?
Short-term services would have no families that are in custody. Those would be in extended services.
Okay, so of the extended services, how
Correct.
many of those are being reunified?
What percentage of our families reunify? Is that what you're asking?
Yes, ma'am.
Is it 45%? Am I correct? 46%. Thank you. It's about 46%.
And what's the
Phone
time
fine.
frame for reunification?
We are expected to try to reunify within 12 months or less. We would have to give you data that shows what percentage of kids reunify within 30 days, 90 days, and it does go past. We are allowed 2 6-month extensions in court, so we have about a year once your child enters custody to either reunify your child or make a different permanency plan. If you are a parent who is actively working your case plan, the court allows for 2 6-month extensions for that parent to continue to try to get their child back. So in essence, you have potentially up to 2 years as long as you're actively involved in trying to reunify your child.
Okay, so with that said, you said the roughly 46% are being reunified, so that means that the majority are not. So is there enough foster care placement for kids that are not being reunified?
No. What we can share with you is that our placement with kin has gone up extensively. We are doing a lot more placement with kin. The reality is not all of the children of Cuyahoga County are placed within Cuyahoga County. We are relying on resources outside of our county for the placement of our foster kids.
Okay, and with the bridging, then this is probably a question for the person that, for the lady that talked about the collaboratives, the staffing levels. How is that determined when it comes to the visitation and court, going to court? They said they provide a partnership. So how is that determined? Who gets that need filled? Because it sounds like there's a seemingly overwhelming need for that.
I'm sorry, so you mean how is it determined by the collaborative?
Is it determined by the collaborative?
So once it's geographically based. So the workers will send the referrals to the prospective collaborative, and then all the work for that family goes with that specific collaborative. And so the staff are assigned the families within the staff that work within that organization.
So when they need to do visitations, or if they need support with child support services or going to court, is that something you offer?
Yes.
And you said you would go with them. So do you have enough staff to be able to adequately support the demand of the need currently? Honesty is best.
Yes, we do. Because the contract is new, there's been a shift in our numbers. And so I can speak for Westside in that we have 44102 and 44109, which have a lot of involvement. And so we're seeing a great increase in the work that we're doing. So right now we're able to sustain, and like I said, we're seeing that increase, and we'll see how we'll be able to manage that.
Okay, and then, Ms. Wise Kelly, you talked about, free training will be offered to the daycare providers, and I was wondering who will execute that training, and will it be the current, staff, and does it take away from any of the caseloads that are being currently handled?
So the training is being offered this Saturday, and my senior manager of the hotline will be conducting the training.
Okay, and are you prepared to handle the calls that will probably come in as a result of the training?
We will do our best. We will respond to every call that comes in.
All right, that's all I have for now. Councilwoman Conwell? Thank you.
All right. Anybody else before I jump in? Yeah. Councilman Miller.
Thank you very much for coming and presenting on this very, very serious and important topic. In your presentation, you described, I think, 3 different levels of reviews. There's internal reviews. There's the child fatality review, and then there's the last one, the child protection oversight evaluation review. And my question is, in the course of these reviews, particularly in looking at some of the unfortunate cases that have occurred, have we identified any improvements or any changes in procedure that need to take place? And what we've identified, is it more that that people failed to follow procedure, or is it more that a better procedure is needed, or is it that that no matter how good the people and the procedures are, that you're not going to prevent everything?
I definitely think it's the last option. What I would say to you is that although this agency is given the responsibility of ensuring the safety and well-being of the children of this county, we can't do it alone. We alone are not in homes day and night. We respond to what we respond to. We provide services, but it really takes an entire community to keep the children of the community safe. We need our mandated reporters. We need our community supports. We need family members and neighbors that when they see something, they speak up. And so what I would say to you is that we do our best, but there are times when humans are not, you can't always predict human nature. And there are times where you believe you have a good plan in place and something can change in that family in a minute, and all of a sudden a child who was safe may not be safe. And so I would say, yes, we alone can't do it. And unfortunately, even when we do our best work, there are times where the outcome isn't the outcome we would have wanted.
In looking at this process, I identified 6 decision points where conceivably mistakes could be made. One is the screen-in decision. The second is deciding to close a case. Third is recommending or not recommending removal of a child from a family. The fourth is foster care placement. The fifth is permanency placement. And the sixth is approving reunification. And I'm wondering if there's any of these in particular that you think maybe we need to pay more attention to than we've been paying so far.
So I think that, again, the decision to remove, the decision to reunify, the decision to terminate parental rights, much of that work happens in the team decision-making meetings. And so when I was a young worker at 22, I was deputized by the court, and I went into people's homes, and I alone made the decision of whether your child came into custody. When we implemented team decision-making, what that allows is a team of folks to sit and look at a situation. And so I think, although not perfect, those decisions being made by a team, those are people who have much more experience than I did at 22 doing this job, sit together with our community partners, with the family members, with the service providers, and they work together to make those decisions. As far as the screening process, the child protection specialist makes the initial screening decision, and then it is reviewed by a supervisor. And then the manager of that department randomly pulls some of those screening decisions and looks at them and uses them as teaching opportunities. Again, when you screen a call to the hotline, you can only use the information you were given. And so one of the biggest struggles sometimes is that if someone calls in anonymously, or they refuse to leave a phone number and you have a question, you have no way of going back and getting that question answered. So you are left only with the information you were given. That can be difficult, and I don't know the answer to fixing that. What I know is that we continue to look at those screening decisions, and then what we do, all those decisions, even the ones that were screened out, that weren't investigated, we have the ability, we capture those in the system. So if another call comes in on something we have screened out, we have the ability to read the prior screen out and also to look at, was that screen out a good screen out decision? So I would say to you, there is some check and balance to that, but of course there are some limitations. We only know what is being told to us. We only know how someone is presenting the information, and then we have to make a screening decision based on that information.
Madam Chair, Director, the 6 decision points I mentioned, are those the main decision points, or are there some that I've overlooked?
No, the decision to screen in and screen out is the absolute first decision point. Any decision around the removal of children or the return of children is absolutely a strong decision point. As you also mentioned, the closing of a case is a serious screening decision. Again, when we close a case, if that case reopens, we do know what percentage open within 6 months of closing or 60 days of closing and which ones do not. So again, those are teachable moments. Again, though, a closing could happen and a family's life could change drastically in 6 months. So closing it 6 months ago might have been the right decision. In that time, there's a new boyfriend in the home, there's a new baby in the home, maybe somebody has developed a substance abuse problem. So when you look at it 6 months later, the family you're looking at might look different than it did when you closed it 6 months ago. But you have hit the major points.
Madam Chair, Director, regardless of any incidents that have occurred, or even if there's no incidents that occurred, good organizations are in a process of constant improvement.
Absolutely.
My question is, what kinds of improvements are you focused on over the next year or two that you would like to be able to accomplish, and how are you working to accomplish them?
So when Dr. Harris talked a bit about performance evaluation and innovation, some of what we have decided to do is really take a deeper dive than SEPO does into our records. So SEPO right now may review 5 records or 10 records, which isn't even significantly, it's not at all helpful. We plan to implement a process where we're going to look at 100 or 200 cases, looking for trends, things that we are constantly working on, making sure that we see the entire family, making sure we understand the role of the father in the family, and ensuring that he has a role in the investigation. I think that we're looking at the back end of the system. As I've mentioned, we have over 500 children today that are our children, the county's children. Their parental rights have been terminated. What we know is children grow best in families. So them living in foster care or residential facilities, and not having a permanent family connection will set them up for certain concerns. Children who age out of child welfare, more likely to be incarcerated, less likely to have a job, less likely to finish high school. These are other things that we need to work on. We need to make sure that every child who becomes our permanent child gets a permanent family. So those are some of the things that we're working on.
Thank you, Madam Chair.
Councilwoman Baker.
Thank you, Chair, and thank you, Director. I guess I'm going to maybe just ask a little bit more about those hotline calls, because that does seem to be where everything begins. The 14,000 calls that are determined to be screened in, 51% of those are listed here as physical abuse and 45% as neglect. With those numbers, over 7,000, I guess, of those 14 are physical abuse. And to me, that would be categorized as a higher level of concern along with neglect. And that may not be the emergency call. It may be an ongoing practice that is happening in those homes. So how do you categorize, when you talk about levels of cases, where do you put those physical abuse and neglect numbers in a place that is perhaps different than other issues that you may, the other 49% and the other 55%? How do you manage that in a way that perhaps could be a chronic problem and not just an emergency, we need to take care of this because the call came in? I guess is my first question.
So if I understand the question, I think the way I would answer the question is the way we screen in calls and the way we respond to calls have to do with what's being reported in the call. So if a call comes in which the information being given would suggest that if we did not respond immediately, a child would be in an imminent unsafe condition, those are screened in as emergencies, meaning a worker would dispatch within 1 hour to see that child. Such cases might include things like a neighbor calling in and saying that they saw mom leave and there's a 2-year-old alone in an apartment. So things that we consider when we're deciding on emergencies and non-emergencies include things like the age of the child. The younger a child is, the less ability they have to self-protect. So a child who doesn't go to school isn't being seen during the day by other professionals. So small children, infants can crash very quickly if they're not being fed or not being taken care of. A child who's 6 or 7 still has more ability to self-protect than an infant does. They are typically being seen in a school setting or another setting, so we have other eyes on those children. So the age of a child impacts it. What's being alleged? If what's being alleged is that mom has a serious opiate addiction, she is not feeding her children, she is not seen to their medical care, she leaves them for long periods of time unsupervised, that would be the kind of things that would cause the level of concern to go up. Cases where there are of concern, but not as immediate of a concern, might be educational neglect. Educational neglect is a serious concern, but a child isn't going to die of educational neglect. That is more a chronic situation. So what really has to happen there is that staff have to figure out, why is the child's education being neglected? So again, is it because the parents don't value education and so they just don't get their kids up? Or is there a deeper reason for that educational neglect? Is there a drug problem in the house? Is there domestic violence in the house? Is there serious mental illness in the house? Are there other factors that result in this child not getting to school? So even though an educational neglect on the surface would probably not be screened as an emergency, there is still a need to go out and look and do an assessment to figure out, why isn't this child going to school? Once again, in an educational neglect case, a 6-year-old not going to school and a 17-year-old not going to school can be for very different reasons. And frankly, a parent's ability sometimes to get their 17-year-old to school should look different than it does when you have a 6-year-old. So those are some of the things. There are a lot of factors we look at. Age of child, what's being alleged, what kind of history does the family have? You know, are there marks and bruises being talked about? Is it a medical provider calling us saying, look, this child is presenting with these concerns? So again, everything relies on what the person calling tells us and what my screeners can learn for the person calling in. They ask lots of questions. So wherever a person calling in can give us more detail, it helps us to make a better judgment about what kind of response we need to make.
If I may, and I understand that, and I don't want to make any assumptions. The 51% that you identify as physical abuse would not be the educational neglect.
Correct.
And the 45% of neglect is not the educational neglect.
They would be included in that neglect. Educational neglect would be included in neglect calls.
Okay.
Neglect can include things like failure to get your child routine medical care. Sometimes issues around how often you're feeding your children can be issues of neglect, unless what you're doing is withholding food as a physical form of, and you're starving your child. Now we've moved into a different area. So there's complexity to it. Everything doesn't fit always neatly into one or the other category.
The 51% physical abuse, we'll stay with that because that seems to be a pretty clear cut. If you were screening for that, have identified in that 51% that there is physical abuse involved, does that raise to a level of, first of all, emergency, and then, of course, examining the child to see if there were perhaps other signs of past abuse? And does that child at an age where they're able to speak and give an opinion, does that child's voice get heard as part of the assessment of whether this is an emergency, a one-time, we're going to come in and take care of it, or it becomes a long-term, this raises to the level of between 1 and 10, a 10 being the highest level, and that something needs to be done immediately?
So absolutely, the investigative standards require us in any investigation to speak with children who are able to, so obviously we get waivers for children who are not able to speak or have a disability, so they're not able to speak. We are required to try to interview children separately from their parents. We ask parents to allow us to talk with their children outside of them so that we feel like we get a stronger feeling from the child of what's going on. We are required by investigative standard, if we have concerns about marks and bruises, depending on the level of the concern, we may ask for a medical exam of the child to get a better picture of what does this look like. We certainly would interview the other children in the home. There are times where there is one child in the home that is scapegoated, and so it's important to interview all of the children in the home to hear about what is the disciplinary practice of this home. So all of those things would weigh in. It is possible that we would respond for the very first time on a physical abuse allocation and remove immediately. And it is possible that depending on the details of that discipline, is it discipline or is it abuse, we may not remove. So there's a lot of factors that go into deciding if something is physical abuse versus is it physical discipline.
I'll just wrap up, is the physical discipline part of your 51%? When you say 51% physical abuse, is that?
So keep in mind, it's the way it's screened in, not the way it's dispositioned. It's what was being what's being alleged in the what's being alleged by the screener. If it's true, that's how we screen. A call is screened in if what you're alleging on the call, if it is true, would be physical abuse. It doesn't mean it was physical abuse. It means that's the way it was screened in.
Do you have a percentage of that they're actual, of the 51% called in as physical abuse? Do you have a percentage?
We would have to get it for you. I do not know it off the top of my head.
I would appreciate knowing that.
Okay.
Thank you, Chair.
Council President Brady, and then Hauser.
Thank you, Madam Chairperson. I want to shift just a little bit. These have been some very penetrating, I think, and important questions that have been asked. Director, first of all, I just want to, compliment you when you were mentioning the fact that you had been a social worker since you were 22. That's.
It was more than a few years ago.
I'm impressed with what that implies, and so I know it's quite a commitment that you have to your work, and so I want to absolutely respect that in every possible way. I'm going to just speak or move briefly to the issue of resources. Now, this is something I expect as part of what this committee will do, Madam Chairman, in my opinion, is as one of the things that we're going to look at. I think what I'm interested in us looking at is, along with the systematic presentation of how we do what we do that we've been going through, have a fairly open conversation about resources. You've been doing this for quite a while. It's not an ideal world we live in. There are limited resources, but there are resources. And if you could, on your own, which nobody can, but if you could on your own, give us some suggestions where if you had more resources, what you would do. What would you suggest that those resources be used? Could you share that with us?
So as we've shared, we have seen a significant increase in referrals being screened in the first quarter of this year, and we have seen an increase in custody. If that trend would continue and caseloads would continue to go up, we would really need to consider, are there enough staff doing the frontline work? At this point, what I would say is there are other opportunities for resources. For example, workers, when we bring kids into custody, also have a huge expectation that they're getting those kids routine visits with their parents, which often means the workers are doing the transporting of those children. Sometimes I think the additional supports of additional transportation people, taking that off a worker's plate. One of the things we would like to do, and we know what research says, the more often a child sees their parent while they are in custody, the greater likelihood we have of reunification. If I am a worker in extended services and I am carrying 13 cases and our average caseload is 2.4 kids per case, and I am supposed to be making sure all these kids visit their parents routinely, and all of my kids aren't placed in the county, you can start to see how often my kids might be seeing their parents. And so, the support of having more, we have a small transportation department, having a greater ability to rely on supportive staff to help with things like that would be a huge benefit to workers. There are technological things that could be of help. We have started getting iPads for our staff. There's huge amount of expectations around documentation for these staff. My extended service workers especially spend long time sitting in court waiting on court hearings where they're barely able to do anything because we no longer use pen and paper to document. We document in a system. So having that technological support for them, that as they sit for a court hearing for 2 hours, sometimes, they could be sitting and updating their conference notes and making sure everything in the system is updated. I think that we have prided ourselves, the opiate addiction, thank you, has not hit us as hard as Hamilton County, but it is hitting us. We have had a START department for years. The START department is the sobriety treatment and recovery teams. And the idea of the START department is we coupled a caseworker and a person we call an advocate. And the advocate is someone who typically has had their own substance abuse problem and gotten past it, or they come from a family with huge substance abuse. And those advocates are the key to getting those families into treatment. They pick them up for 12-step programs. They say, come on, you can come to my home meeting with me. Let me help you get assessed. Let me tell you how I got my kids back. We don't have all the advocates we once had. And I think increasing those advocates would help us with our drug cases. So those are a few things I could think of.
Okay, thank you. Madam Chairperson, just a little follow-up. In terms of training, there's we've heard from the beginning about the turnover. Could you, although we've heard it before, we need to keep hearing it, I think. Why is that the case beyond how difficult the job must be? What could we do to mitigate that? Are we providing the training that we need? How can we make the job, other than the things you've already mentioned, of course, what are the things that we might be able to do to make a caseworker less likely to leave and more satisfied with a work environment that would be difficult some days regardless of what we do?
So I'm not that unique. Many people enter child welfare right out of college. It's a first job for many of us. And so we have a pretty extensive training. Workers, when they first come to the agency, go to about 12 weeks of training. And during that training, they are also doing what is called shadowing. So where there are days you leave the training center and you follow an established worker and you go to court or you go to a team decision-making meeting. So you're getting a really good understanding of what the job is. So what we're doing well is we have started behavioral interviewing. I think we're doing a better job of hiring the folks that are more equipped to do this job. I think the initial training and shadowing experience we're offering them is helping. A 5% vacancy rate is also, as you say, we bring in at least four classes of social workers every year. So we're seeing a pretty significant number of a lot of time and effort invested into staff, and some people not being able to stick with it. Again, I think we're doing a better job of bringing people in. I think where we could continue to improve in child welfare, in social work in general, the idea of secondary trauma. I don't think I could adequately, I will tell you the truth, I can remember almost every child I removed from their home. I haven't removed a child in 25 years. It is the right thing to do sometimes. It is the hardest thing to do. To pull a child off of their parent as they are screaming, this sits with my staff. They have what is called secondary trauma. They see so many difficult situations. They've got to do something with that. In our child fatalities, we have what is called peer support. So when we have a child fatality, we have volunteer staff in the building who immediately reach out to the worker who had the fatality and says, how can I help you? What can I do for you? I think efforts put around supporting our staff and around the well-being of our staff as it has to do with secondary trauma would help some staff maybe be able to stick with the job. The other things, obviously, if a lower caseload is possible, that will make less stress. But at the end of the day, truthfully, regardless of the size of your caseload, what you're experiencing walking into people's houses, you got to be able to do something with that. Mm-hmm. And we need to provide additional support for staff around what secondary trauma is. Mm-hmm. Even saying to staff, it doesn't make you weak because you have secondary trauma. It makes you human, and you're the kind of person we want working for us. Mm-hmm. But it's very real. And it's not highly talked about, and it's not the way to support staff, and that would be huge for staff.
Okay, well, just one follow-up question, Madam Chairperson. You had mentioned that while you have some success, and if I remember the number right, about half of people in your custody, children in your custody with reunification. Yeah. There's the other half, and you said you were asked a question about whether there was adequate foster care, available, and indicated that probably not. Can you give us any idea of can you help us think about what we could do to make that, improve that situation?
Some of the struggle when I was a young worker, we had many foster parents where the family, only one parent worked and the other parent did fostering. Fostering is not a job. It's not a job in the sense that you receive compensation beyond what you're giving. The amount of money a foster parent is paid to take care of a child is pretty minimal for the expectation of what they're being asked to do. There are models in the country where they have what are called professional foster parents, and they actually pay people more of a salaried kind of thing to encourage foster parenting. I think now what you have, one of the barriers that we have addressed with some of our foster parents is daycare. When I was a young worker, if I came in that building with a newborn, I'd have a foster home before I got to my desk. It is very hard for me to place babies because babies need daycare if I live in a family where one parent or both parents are working parents. Daycare is hugely expensive. And the foster parent per diem does not cover something like the cost of daycare. Now, we have done some work around providing daycare for our foster parents, but it feels like it's a dying profession, to be perfectly honest with you. We had a lot of foster parents who decided to retire. Some for a good reason. A lot of our kids who go permanent custody who have lived in a foster parent's home for years, the foster parent then adopts the child. So that child has been with its temporary family and it becomes their permanent family. So some foster parents we lose because if they have enough children in their home, they're not going to continue to take foster kids. But the reality is we work every day on recruiting foster parents, every single day. It is a huge process to get through. There are legal pieces of that, so certain criminal records would prevent you from ever being a foster parent. Some of that makes some sense. Some of it, you think old crimes, when am I rehabilitated? Same problem we run into sometimes with kin. The other piece is we don't pay kin to take in their family. Some states do. Some states do what is called subsidized kinship. So you get a per diem. And I'd be honest, if I had to take 3 or 4 of my nieces or nephews home tomorrow, you got to think about how that would impact your family. And not everybody can just bring additional children into their home and can financially support that. So I think those are some of the barriers that keep us from being able to recruit the foster homes that we need.
Okay, well, thank you very much, and we'll hold anything else for later.
Councilman Hauser.
I only have one question, and again, we all thank you for your work. I remember speaking with Director Merriman, a similar question. Have we looked at any sufficient models across the nation that other job and family services are doing that are just doing it extremely well, where you call 696 kids, you get directed to a caseworker, the caseworker has been trained adequately, they can go out to the home and in a timely manner and make a good decision. Have we looked at any other different models of job and family services anywhere that are doing it real good, where we could model or implement some of the things they're doing?
So as a large urban child welfare agency and in our long-term relationship with the Annie E. Casey Foundation, we have the benefit, Annie E. Casey goes across the country. So when we're looking at services or looking at programming, we are able to turn to them for us to guide us to different sites in the country that maybe have a piece of the work they do well. What I would say to you is, we are the county that Casey often sends people to learn about child welfare. We, last year alone, had 3 different visits from different counties coming in to look at pieces of our practice. Much of what we do is considered best practice. We are not a perfect system. We are a system that needs to continue to improve. But much of the stuff we do, the team decision-making practice, the use of our data, the way we do support our foster parents, many other sites come here to see what we're doing. So yes, we have looked at other jurisdictions. We have partnered with other jurisdictions. We just finished a project with Annie E. Casey called On the Front Line. We were one of 3 sites in the country that was chosen to pilot some new practices. They really helped us with our vacancy rate, how we could keep our vacancy rate down. So, you want the right staff doing the right job, but you need staff on the job, because when you have vacancies, your caseloads will go up. Families will continue to move from this worker to this worker. None of that is very positive. So I am very proud of the fact that our vacancy rate is less than 5%. I don't want to misquote, but I believe Franklin's and Hamilton's is unbelievably much higher than that. Frankly, getting people to work in child welfare is difficult. It's a hard profession, and it's hard to recruit staff into this job. So yes, we've looked at others. Yes, we've been involved in national models. We are currently one of the 6 sites in the country that is doing groundbreaking work on the LGBTQ population. We were one of the sites chosen to try new work because we know that children that come into foster care have a higher percentage likelihood of being involved in the LGBTQ community. There are much higher suicide rates, so there's work we're doing even with that population of kids. So again, we have a long way to go, but we are a program where we are very open. We also work with Casey Family Programs. The Caseys, there's a lot of them. There are a lot of cousins to the Casey group. Casey Family Programs has helped us with permanency work. So this whole idea that every kid gets a family. We've done permanency work with them around reducing the number of kids waiting for permanency. So.
Thank you.
Councilwoman Brown.
Thank you. Again, I really do appreciate the work that you do. Some of the questions that followed up as my colleagues were asking questions that came to mind were, it sounds like clearly the needs are great and the demand on the staff is heavy. And Council President Brady touched on more resources, but I guess for my question is regarding morale. We talked a little bit about recruitment, but what would you say, given a scale of 1 to 10, if 1 is the worst place in the world to work and 10 is the best place in the world to work, where would you say we scale on morale?
Very interesting question. We work on culture and climate a lot. So we do work on our transparency and leadership. We work on our ability to involve our staff in some decision making. What I will say is that the culture and climate right now of the agency, I would say a 3 or 4, and I'll say why. What people don't understand about child fatalities and a light being shined on the agency, it causes staff to be afraid. In this last fatality, we have a worker who received death threats on Facebook because her name was published. And so you can imagine if you're the coworker of somebody who is receiving death threats because she handled part of the case of this last fatality, that alone will cause your morale to go through the basement. Mm-hmm. If you feel like when we experience fatalities, and this is not unique to Cuyahoga County, this is true in child welfare, you will see custody numbers go up, meaning more kids coming in, but what you also will typically see is kids not going out, kids not leaving care, because the workers are thinking, oh, no, I'm not going to be the one who sends in, I'm not being on the front page tomorrow. Mm-hmm. That's not me. Mm-hmm. And so morale right now is really tough. Trying, for lack of a better way of saying it, to say to our staff, we have to get back to the work of what we do. We are professionals. We do not kill children. We are good at what we do, and tragedies happen, and we must be able to get past those. So I would say right now, we're in the 3 to 5 range. We continue to work on it. I think the peer support that we do that I referenced earlier is a support. Nobody wants a fatality on their case, nobody. But the feeling that somebody is sitting there with them saying to them, how are you? How are you doing with this fatality? We offer crisis leave. If you have a fatality on your case, we offer you up to 3 days off to take care of yourself. So those are small things we are doing, but I would say morale is not great at the moment. So
knowing that, and you talked about staff support as well. So peer-to-peer support, I can appreciate that, and in a 3-day opportunity for them to kind of recuperate and reevaluate. Are there any, if you could provide more, what do you think would be a way we could improve the morale? Because clearly that is going to impact the delivery of services. So is there something we can offer or provide if we had more resources to improve morale?
I think what people expect me to say is pay people more. And I suppose there's value to that, but your value in your work is not all about how much you are paid.
Agreed.
I think that what staff really need are people coming in and thanking them for the work they do, acknowledging their hard work. Stories that hit the press are only the sensationalized stories of what happens. But what about the other number of children that we saved from difficult situations? Absolutely. And part of that is difficult because of confidentiality. We can't, even in this case, we can't talk about the work we did on this case, not in any detail, because there's confidentiality as it should be. But I think that staff don't feel like the general public, the people that they work for, really understand their work and actually want to thank them for the hard work that they do.
So how well do the directors and the supervisors execute that with the staff? How often are there any type of camaraderie building or activities or anything like that?
A few. March is Social Worker Month, so we do big celebrations in March. We try to acknowledge and recognize people in our own building in ceremonies and things like that. We have what we call Star of the Month, so we try to have coworkers and others write stories recognizing coworkers, and that gets published. We try to individually, even myself, sending emails to my staff when they're caught doing good, as they say. Mm-hmm. So we try really hard with that. I think that most staff appreciate that. I think it's still that feeling of, yep, the director might know what I do, but the general public, the people all around us, really see us as baby snatchers and people who allow children to die. And so that's a huge burden for them to carry.
And the other thing I would just kind of maybe suggest or even inquire, because I don't know the level of interaction with the supervisors, but to your point, all of those things that you named are really great, but I sense sometimes that there is a lack of personal connection or relationships between the supervisors and some of the staff. And if that can be executed a little more at a little more frequency than maybe we have in the past, and that's just my sense. Again, I don't know if that is true of the entire department or a small.
It probably depends on the supervisor.
Right.
I think many supervisors have 5 or 6 workers. Sometimes at any given point as a supervisor, I could have 2 brand new workers. The pull on my time is huge. I got to train you. I got to make sure you know what you're doing. I got to be following up. And I think at times we're so busy in the day-to-day work that the relationship building becomes a bit secondary.
Right. So that is the I think would be even probably a valuable resource or action in addition or above and beyond the ceremonial things that we try to do in our busy day. Just a personal, hey,
how you doing?
Yeah, one of those things. And so the other thing that I would ask relative, you talked about the right staff for the right job, and I know that SACWIS is a big part of the job. And so what type of training do we have for SACWIS? Because from being the chair of the HR committee, I understand that the attrition is high, and then part of the reason for that is some of the individuals that are hired to do the job aren't able to keep up with the workload as it relates to inputting the data. So can you speak to us about that?
It is the use of SACWIS. It's also your ability to type.
Right.
I mean, you need to be able to put your hands on the home row and be able to type, not hunt and peck. If you're hunting and pecking, you're going to have a heck of a time keeping up with the amount of documentation you're expected to do. So we offer ongoing SACWIS training. We also offer to send staff through, for lack of a better word, typing classes. I'm sure they're not called that anymore. They were in my day. But actually teaching you how to use a keyboard in the most efficient way. We've used DragonSpeak a little bit, so when we've had staff who can't manage the paperwork part of the process, we've offered the addition of DragonSpeak, where you can speak your notes into the system and they can be recorded for you. But the training with that is ongoing. It starts from the minute you hit the door. We're teaching you SACWIS. We're teaching you all the different kinds of systems you have to be able to navigate through. And to be frank, some of that is, people have different levels of comfort with technology. And so we try really hard. But again, when I was a worker, we used a piece of paper and a pen. It hasn't been that long. I mean, it's been a minute, but it hasn't been that long. And now you don't even need a pen. You just need an iPad, you need a computer, you need, cell phones. And so it is our ongoing efforts to try to make people as comfortable as possible with the IT.
Would it behoove us to change our standards so that the people that we're onboarding already have some ability to type so many words per minute to reduce our attrition and keep workers?
So here's the difficult part. Child welfare work is really about your ability to engage. You also need to type, but your job is to engage. Your ability to engage families, your ability to get a family to allow you into the door. So being the fastest typer in the room isn't actually going to make you the most successful child welfare worker. It is really the ability to be engaging, and yes, you need to be able to type. So it's not strictly your ability.
And that part I understood, and I also like the idea of the behavioral testing that we're implementing. But I think a combination of all three, like the first thing is being able to engage.
So
and then
giving them a test and seeing where their typing is and getting them going, we certainly could look at that. Absolutely.
I think that would be helpful. And then the last question I have, Madam Chairwoman, is with foster care. There was a two-part question. Do you think if we increase the per diem that would help with our foster care? And what are your thoughts on paying kin?
I think that in the world that we're living in, it is difficult for many kin to commit to taking additional children without some kind of resources associated with that. If we place in kin, they can get child-only benefits, which is a very small amount of money that can come into their home. I think it's something if, again, in child welfare, what we know is if a child has to be removed from their home, the best place and by legal, the least restricted placement is with kin. So if that's the goal we're trying to achieve is keep children with their kin, which would make them in more stable placements, then we need to find ways to offer some financial support for those kin. Absolutely.
Councilman Miller.
Madam Chair, Director, just a follow-up question on Ms. Baker's line. What's the current standard on distinguishing physical discipline from physical abuse?
Well, you have to look at several factors. You have to look at was it issued as discipline? Was it something that happens regardless of behavior, the severity, the age of the child? There are multiple factors you look at when you're distinguishing physical discipline from abuse. One thing I will say is Ohio law does not clearly says the leaving a mark on your child in and of itself is not physical abuse. But there are many factors. Again, if you are using a belt on a 6-month-old, I'm going to call that abuse. That child's ability to cognitively even understand what's going on. So it's the child's cognitive abilities. It's what other disciplines are used. What state of mind are you in when you're using that belt on your child? Are you beating your child every time they turn around for a multitude of things? That starts to go into the issue of abuse. But parents are in the state of Ohio allowed to use physical discipline on their children. It is part of our statute.
And are there other states where it's not allowed?
It's a fair question. I can't answer that question. I honestly do not know.
Okay, and Madam Chair, Director, just a final comment. We've become aware of a couple of HHS directors that are leaving us. Please stay. We greatly value your leadership. Thank you very much.
Thank you.
I apologize for that. Okay, I have put the safety tool. I've given each of you guys a copy of the safety tool. If you can have a few questions in regards to your safety tool. And so my questions in regards to the safety assessment tool, we have 2 copies that are being provided for you. Your campus tool sheet and your safety assessment factors. And this, for the audience, this safety assessment factor is utilized when you go inside a home, correct?
When you're completing an investigation, you're assessing safety, correct?
Okay. So it's numbered from 1 to 15. So when a caseworker is assessing the responses, how many responses are needed for DCFS to intervene? So when they're rating it and they're going in, is there anything that sticks out in particular that will let the caseworker at that time in that home know that they should remove that kid? I've read over some of them.
Any of the specific factors? Well, we might answer the question by saying any safety factor where a child is found to be unsafe, then we have to indicate what was done to mitigate that safety concern. So you could have factors where a child is found unsafe, but you're able to put an intervention in. So for example, we have a parent who has a serious drug issue and they're leaving their children home alone. An intervention might be that grandma agrees to move into the home temporarily while the parent goes to treatment. So just an unsafe, actually what that means is then you have to take the next step of how do you remove that child's status of being unsafe. Sometimes removal of the child from the home is how that safety concern is handled.
Okay, is that because we're trying to make sure that the audience and the residents of Cuyahoga County are clear with this? Because case scenarios could be totally different. So caseworker goes in the home, the safety assessment tool says that the child should be removed. For whatever reason at that moment, we don't remove because we know we have a procedure. Something happens with that child. Then the community is in a,
Oh, no.
Okay.
If a safety assessment is completed and a child is unsafe and there is no way to change that, we can immediately remove a child from their home. We can do a couple of things. We can call the police and they can immediately remove that child and bring the child to us, and that is called Juvenile Rule 6. We then have custody of the child. Or we can immediately, through our prosecutor's office, make contact with the court and ask for an immediate order of removal. So we would not, in general, have somebody in a home saying, gosh, these kids are unsafe, now I'm going to go back to the agency and call a meeting. We would do something. They would call their supervisor from that house and say, I believe this child is unsafe. I can't put a plan together to change that. We sometimes say to the family, will you come with us to the agency and we're going to hold a meeting right away with you. And there are times families will come with us.
okay, so as the caseworker is going down these safety assessment factors, if there are sections that are unsubstantiated on the safety factor check sheet, how is it determined if the case should be referred to the court? So my thing is, you're doing the safety assessment tool, and so it's that caseworker's determination if that kid is safe or not. I'm trying to see from my perspective of not knowing and not going into kids' homes, what stands out to that caseworker that this child is unsafe and I need to do something immediately?
You know, so like Cindy said, it's a lot of those things. You know, every situation is different. You have to look at the protective capacities of the parent. You have to look at the trends. Is this an isolated incident? Is this multiple referrals alleging the same kinds of things? Access of the perpetrator. Is that somebody who is living in the home? Is this somebody who has immediate access to the child? Age of the child, the ability to self-protect, the other eyes and ears that are around the family. Is this a school-age child that we have the school that has got eyes on the child? Do I have a Help Me Grow worker in the home? Do I have grandma who's moved in the home? If I can't do an immediate safety plan in-home, then I have to do an out-of-home safety plan, which means removal. Okay. And so if I can't wrap services around in the home, then the child has to come out of the home.
So case by case, but your main focus is going in there as a caseworker is to keep that child in the home.
No, our main focus is to
But I
keep
mean,
that
looking
child
at the
safe.
safety, I mean, looking at the child's safety, I don't want to misspeak. So you're looking at several things. You're
Yes.
looking at the safety of that child in that home, but
the
one of our
reality of
key
law-
missions, you know, safety is one thing, immediate, you know, and things can work out. But our mission overall is to make sure that we keep kids with families. I'm not saying if they're unsafe or not unsafe, but that's our overall mission.
Kids with families, hopefully their own, if not with a then substitute care provider, which is then a foster family or a relative who can provide. We are required by law to try to work with that family. That's about the reasonable efforts piece. So we are required to try to remedy the situation that kept the child unsafe.
And I have a follow-up question in regards to, I believe, Councilwoman Brown asked you to share the old model and how it was different with the new model. My question on that would be, how was the caseworkers prepared to transition to this model?
So the transition to the new model took place well over, it wasn't like one day we all got up and moved to a new chair and had a new job. So what happened was we started in short-term services. So we had 2 units that were former ongoing staff transitioned to short-term service first. They were given training, all of their current cases were then moved out away from them. They went on case rotation, they joined the short-term service department, and they were given any kind of training that they needed that they didn't previously have in their other job. That happened first. It took us about 6 months to create short-term services. Once we created short-term services, then we started the transition of the extended service model, which includes adoption staff and former ongoing staff becoming the same group of staff. And so that too took several months for us to transition those caseloads. We sent people to extensive training, supervisors. If a worker said, I don't know how to do this form, we also put experts in each department. So if I was a former intake worker who was really good at my job, I was identified as an expert to the other people joining short-term service, that they could come to me as a worker, as a soup, and I could provide them additional support in their day-to-day work. So if I was a former IL worker and I've never done independent living work for a teenager, that person was identified as someone I could go to who would show me how to do independent living work. So there was a lot of teaming that went on. There was a lot of training that went on. The actual entire transition took over a year to be accomplished. So I think sometimes it's portrayed as one day we just shifted our model and everybody got up and moved to a new chair. The other thing we have done with the new model is we've paid attention to our data. We've paid attention to the serious data points that are indicators in child welfare about how practice is going. We've looked at our cases reopening quickly. We've looked at length of stay. We've looked at repeat maltreatment. We have paid attention to those data points, and in the fall, we plan to have an evaluation of the new model completed. One of the things the data folks told us is a new model needs to be in place about 18 months before you can evaluate it. But our intention this fall is to do some evaluation of the model to see, does it work the way we believe it works? Is it providing families more continuity of care? And is it reducing some of the barriers that existed in the old model?
Okay. Moving on, Councilwoman Brown had a follow-up question in terms of, do you have an estimate of what that cost would be for the KIN program?
I do not.
Okay.
Jackie?
And
I was looking at my kin deputy. She doesn't either.
so you stated earlier, or someone stated earlier, that the average caseload for a caseworker to have is 16.26. In your opinion, what are the ideal caseloads for a caseworker to have?
So when we moved to the new model, our best estimate was that short-term service would have caseloads of 12, which would include investigations, as well as they would have a few families in short-term. And that caseloads in extended would be 8 to 10. So we are above in both. What's difficult to know right now is the increase really related to the intense media attention we have been getting, and the increase, if that will continue.
Okay. So we're way over caseload sizes, correct?
We're pretty high.
In every department.
We're
'Cause
pretty high.
You have short-term sex abuse, short-term regular abuse, neglect. You have START. How many cases in START?
14 to 15.
Okay. And I think that was one of my, is caseload size the same? So you painted an overall picture that it was 16.26 average caseload, but you didn't really allow everyone to know that caseload size and is it the same in every specialty? Because
No.
specialties are.
No.
So you didn't, so I just wanted everybody to know that there's different specialty cases like sexual abuse. So 16.26 would be horrendous in sexual abuse and different investigations. But I'll stop my questions for now and go to Baker.
I've only had, just as we're here, to look over the safety assessment factors, so I haven't read all of them, but they seem very, very targeted, very experienced in the questions that are being asked. But for example, the number one question, unless there is a extenuating circumstances, like perhaps cuts requiring stitches that child fell and stitches were needed, I don't see anything on here that wouldn't require immediate removal. I mean, things that broken bones and positive toxology with harm to infant identified, burns from cigarettes, internal injuries, head injuries, serious injuries to sensitive body areas, brain damage. Are there anything in here, unless there's just an unusual exception that this happened outside the home and coincidentally has nothing to do with what the parents are, perhaps what's happening in that home, but if not, aren't any of these that are obviously check marks next to that box a reason for removing that child? And I haven't gone through 2, 3, 4 all the way to the end, but even many of these questions are very, very serious questions that if they were checked, it would be certainly a red flag.
So as Tammy said, it would depend. So say a child, mom's boyfriend broke a child's arm. Mom had no idea her boyfriend could behave in this way. He doesn't live in the home. Mom has put a plan in place that he will not be allowed back in the home. We've done an investigation. That might be a situation where we wouldn't remove that child from his mother because we have ensured his safety by removing the person who victimized him. So sometimes the way we keep kids at home is we get the people who victimized them out of the homes.
Okay,
Often
that's good
very
answer.
true in sexual abuse. Often very true. If we have an allegation of sex abuse, we often try to get the alleged perpetrator to leave the home, at least temporarily, so that the child doesn't have to leave the home. So there is always that work that goes on.
When these boxes, if I may, are checked off and you have identified and you have removed, is this a high-level risk assessment that you would not be part of the larger group of case working, but to be one that you immediately go back a day or two later to make sure that there aren't continual broken bones or cuts or things that perhaps weren't there the time you were there before?
So when we put a plan in place where the child does stay, we put a safety plan in place, which requires a worker to visit the home at least weekly. It also requires that there is a third-party person that has signed off that is also putting their eyes on the child. It often requires the parent to be involved in certain programming, and yes, they are reviewed at the senior manager level on a monthly basis also. So there are checks and balances. We don't simply say, ma'am, you need to put him out. We make sure that that's in fact what happened.
I appreciate that answer. Thank you.
In terms of, let me just ask a question. Are caseworkers allowed to share their perspective on case size? As you stated earlier, that caseworkers have some say in some of their things. Is case size one of them?
I mean, certainly we have discussions with our staff about the size of caseloads and look for opportunities to try to reduce those. So senior managers use several techniques. Some senior managers rotate the assignment of cases so that a worker has a week off new assignments to give them time to do what is called desk work to get some of their cases closed. We at times offer overtime opportunities or other opportunities for staff to catch up. Here's our reality. We have X amount of workers and we do not turn off the hotline. So every time a referral comes in that's screened in, we're responding. So there's the one thing we don't control is how many calls come in, how many calls get screened in. If they meet the standard, we're screening it in and we're responding. So we do look for opportunities. We have opportunities sometimes of workers who really do a great job of keeping up. They sometimes will agree to take on additional work and then do that in their overtime capacity. So we do teaming opportunities, we do desk duty kind of opportunities. And so in that way, we try to work with the workers as well as the union and what's a reasonable way to bring these caseloads down. I'm sorry, that's correct. We did focus groups with staff when we did the shift of the model. We have implemented some of the things that the focus groups have talked about. I, as a director, a few months ago started a supervisory panel. So I have 8 supervisors I meet with monthly because I think the frontline supervisor has the hardest job in the building. And
How many supervisors do you? You said frontline supervisors, so you have several?
Frontline, probably 100, about 100. So 8 supervisors from across the agency were selected to meet with me once a month, and they talk about all kinds of practice, concerns about practice, what works, what doesn't work. We have made changes to practice based on what we have heard from them. Actually, I would very much like to do a worker group. I just haven't quite found the time to do that. I think as someone who worked on the front end of the system, I think that this front end system, the people at the front end know more about our work than those of us sitting and making policy. And so I think the opportunity to meet with staff and hear what really does work, what doesn't work, where policy is hard for them is an opportunity to get their perspective and try to make some changes.
And you do that, or the supervisors?
I do it with supervisors. I meet monthly with a group of supervisors.
Okay, and so what about I think you should, just a suggestion, include also people that are actually doing the job to see what they're saying. Now, caseloads, or we were focusing on caseload sizes, but also in those caseload sizes, I want to bring to everybody's attention, they're not equally distributed. This case could have 1 or 2 children, and this case could have
Correct. We don't-
6 or more children.
We don't
that
do
you have
case
to-
weighting, correct. We don't do case weighting.
So that also is an equitable way to do cases when you're looking at it. And I was a caseworker back then. I never worked with children, but there's a balance between what you're trying to juggle with the new cases and your old cases closing. And so some of the employees will end up staying to 1 and 2 in the morning and have own families. So we have to look at these things as we're going forward. And you're saying that, yes, we might need some additional employees. And which department did you say that would be in? When Council President Brady was asking you about resources, I believe you stated there was a department that you could use some additional.
So transportation or the START advocates we also talked about.
Okay. Next question, why were the specialty units discarded except for sexual abuse under the new model?
They weren't. They were combined with, they're not discarded, I don't understand. I
Okay.
mean, we still are required to do adoption work, whether they are a standalone department or they are part of extended services. They weren't discarded.
Okay. Okay, does training mirror current job duties and expectations for employees and supervisors?
So we are one of the 8 training, there are 8 regional training centers in Ohio. Cuyahoga is one of the regional training centers. We offer extensive training, as I said, as staff come on, but part of that training is real life experience. So while you are a new worker sitting in training, you are shadowing a worker and going to court. You're shadowing a worker and removing children from their home. You're doing every piece of the work you will do once you become out of training and doing the work. I would say we then move workers from training into what are called transitional units. So when you leave training, you don't immediately get a full caseload. We give you cases at a slower pace with a lot more group supervision to really ensure you've got a good handle on what you're doing before you have an entire caseload.
Is anyone shadowing the new people that, caseworkers that come in with no experience? Is anybody shadowing them?
Once they are carrying a full caseload?
Well, just when they come in. I mean, I don't know what.
Well, yes, I mean, so when we have new workers in the transition unit, they often are still being sent out with other workers who are seasoned workers who are offering their expertise, their experiences. When workers go to a team decision-making meeting, there's a lot of other agency staff there that can also offer ideas to that supervisor and say, wow, this worker really has a good idea, or wow, this worker really needs additional training around this. So there are opportunities for other people. When our workers testify in court, the prosecutors will come back and say, you know what, Cindy, this worker did an excellent job, or this worker needs more work on how to testify in a court hearing. So we have different opportunities with different professionals to offer whatever piece of the training you may need. It becomes a little more individual.
Okay. So you do have some shadowing.
Yes, ma'am.
Okay. Caseworkers placed in, I'm very concerned about this, any caseworkers placed in sexual abuse units, the caseworkers that are placed in that unit, do they have more experience? Or are they just coming in new?
The caseworker a new worker could go to the sexual abuse unit. They do get additional training on what's called forensic interviewing, so it's an additional training tool. They also do shadowing. We have the ability for workers to observe sex abuse interviews. We have a two-way mirror. They can sit and observe a seasoned worker and the police doing sexual abuse interviews, so there's a lot of additional training given.
Right. Our So go back and forth for caseloads and training. Are employees trained how to manage a case plan
Yes,
when they come in?
yes.
Okay. Okay, let's switch to policy a little bit. Do we have exit interviews when employees leave?
Yes, HR does exit interviews, and they collect data.
HR here or an
HR at our
over there?
agency does exit interviews with all staff that leave the agency, and then they produce reports on the themes they are hearing from the exit interviews.
Okay, and so how far back does that go?
At least a couple years. Oh, yeah. At least a couple years. I mean, it's not been a
Are we
practice.
looking at it in any data statistical kind of way of
Yes.
looking at the reasons that we're
Yes.
doing that? Okay. Can you tell me what is the state policy? State every 5 days to investigate. What is the policy with the state in terms of investigation? What is the criteria that they're saying that we need to do? in
You mean
terms of-
families we're not able to locate? Is that what you're talking about?
No, just going inside families' homes. So there's a policy that the state has in terms of how often we need to visit that family once we get the hotline call and we go into the home. Is there a difference in the policy that the ORC is stating that we need to visit that home in so many days versus our policy?
I would say we exceed the state standard. The state standard is, like, for example, the state standard with an unable to locate is you need to make 2 attempts in 4 days. Our policy is you will make an attempt every day.
I
So
get
that's-
that, but that's the part where, that sounds great overall, but when you're talking about managing these cases,
The only way I can know a child is safe is I have to see them.
I
It is
get
the
ya.
only way. So
but
if
if
I
that
allow,
staff does not see that kid, and that's our policy. But the state, I mean, I guess what I need to know is, you know what the state policy is, and you still set our policy. And I get you, I'm a mom too, I wanna put my eyes on that kid. But we have to think of what that's doing to the worker.
so we try to offer some support to workers. Sometimes we'll have other workers make the attempt. Sometimes to be frank, we have workers that are much better at finding families than others. And so we have done training with some of our people who could find anybody, I assure you, and we hook them up with people who have trouble finding to try to increase the probability that the worker will see the family quicker and not have to keep going to the home. So we have made attempts, but we have staff that honestly could find anybody, and we have sent them out when we have a worker who can't find somebody to make sure that we place eyes on the child.
Okay, and when we talk about policy, how does an employee accommodate both a suggestion and policy? And I want to,
If they have a suggestion about policy, is that what you're saying? I don't understand.
I'm trying to find, I got 50 million notes here. I really studied on this. So you have but let's go in particular to documentation. So you have a policy that they need to keep up their documentation on a regular basis. And a suggestion is that maybe they should come in the first 90 minutes to take care of that. So that's a suggestion, that they come in the first 90 minutes and before their shift, before anything gets started. But then on the other hand, that they're also, part of the policy is that they're supposed to schedule seeing those families when the families are available. So
So the
that's a
reality-
juggling act.
So here's the reality. You're expected to spend the first hour of each day at your desk, keeping up on your paperwork. As a worker, if you have a family that the only time they can see you is during that hour, you go to your supervisor and they give you permission that day to go see that family instead of doing your paperwork. It's not a hard, fast rule that you can't leave your desk. It's the expectation of way to keep up with paperwork, knowing that every family is different and sometimes we have to accommodate in order to see the family.
In the past 24 months, what was the median of years that an employee left?
It's a really good question.
We have to get it.
We would have to get it for you.
got several, sorry. Okay, social worker fours in each unit. Your social worker fours are DCFS highest level, I guess,
So
caseworker?
caseworker, yes.
Okay. Are they supervisors or that's just a case?
So social worker
long-term
fours is
employee.
a promotional position. And it is through an interview process. It's not just the most senior worker that is selected for those positions, and no, they are not supervisors.
Okay. Any recommendations that they should be in certain, because they're I'm assuming that they're your highest or been there for quite a while, very experienced caseworkers. Are they spread out in each unit?
So social worker fours work in very specific areas. Our third-party investigations, which is also known as SIU, MIU, have staff that do what are called third-party investigations, meaning they investigate folks acting in local parentas of parents, daycares, hospitals, residential facilities. We also have social worker fours that are our case review facilitators that facilitate the team decision-making meetings. We have talked for years about something called a master social worker, where we would have positions available where a worker could be a social worker for assisting a supervisor and in using their experience to assist with the unit. We have never put that position in place.
Okay, I have questions on collapse, but I guess we could save that to next time. Just one final question. When case sizes go up, does the need for collapse go up necessarily?
Absolutely could be a correlation. I mean, the more families we're serving, the more families we're trying to keep intact or trying to get their kids home could in fact mean more referrals to the community to support that, the collapse.
Okay, well, we are over time. I started about 5 minutes late, so I wanted to make sure that I go over. So hopefully all of you can return next time, at next session.
So next week, we will hear from the prosecutor as well as the administrative judge for juvenile court to take you further into the process. Now the decision has been made to do a court intervention, whether that's court order supervision or custody, and they will walk you through those process. But yes, we will all be back.
Yes, Councilwoman Baker.
Thank you. I've been thinking here about the morale that you put our workers at a 3 or 4. In talking with our workers and those that are in the field and really in the grassroots of doing the best they can, do you think that there are times when they wish they could have done more, that they were restricted in what they have done, that their caseloads are too heavy, if I could have, would have? Besides the spotlight that's on your particular course of business, is there also perhaps a piece of, I wish I had more resources, or I wish I could have done more for this case or that case, or is there anything there in
Yes.
talking with them that
I'm sure.
we're
I am
learning
sure. You know,
perhaps?
when I am balancing different families' needs and trying to make sure everybody gets what they need, it means that I'm spreading myself across cases. So for example, if I'm a worker in extended and I have 8 families that all need to visit their kid this month, then I need to make sure they all get a visit. What I might wanted to do is have made sure they all got more than one visit, but the limitations of my time only allowed for them to have one. So absolutely, there are times where a worker is constantly reprioritizing their work, constantly juggling more than one expectation. And so absolutely, I'm sure there are times they feel like if I had more time or I had more resources, I could have done more. They're doing the very best they can. They're doing the work that few people could even begin to understand.
I hear you on that, and I guess when we're asking if more resources are needed, that may be perhaps an area that can be asked. If we did have more resources, what do you hear repeatedly said that if I had this, if my caseloads were lower than that, if I was able to perhaps not stay in the box that I'm instructed to stay in, if I could cross over, maybe I could have done more. If that could be part of perhaps the conversation that you have with your workers, there may be some repetitive things that you hear that we may be able to assist. Thank you.
Council President Brady.
Final comment. Director, again, thank you for your participation today. I know that sometimes the way that we have to operate as a public body and have these kinds of hearings is sometimes stressful and difficult. It is, however, necessary. And earlier you had mentioned, and it really struck me, and I understand what you mean, of course, is that if you were talking about the morale and how if something is in the media, it's usually bad. It might even be terrible, and all the day-to-day work and month-to-month work that goes on is not really known very well by the public. And so I sympathize with that. It's something I know is difficult to live with, and it's not a great analogy, but in some ways we have a sense of that. But finally, just last week, the voters were very generous, as they have been, and over 70% of the voters renewed the Health and Human Service levy. It's this council that has the responsibility to put that on the ballot under our new system. We did that. We did that unanimously. Obviously, lots and lots of people were involved in that campaign and raising the resources for that campaign and all of that. But more importantly, all of these, all these great citizens of this county say, yes, we believe in what you're doing, even though you may not feel like it or may not think they're thinking about you when you're doing it, or somebody else might not think about they're thinking of them. But they're saying, yes, we agree with this, and they want it. They want to contribute. They don't have to. They want to. And one of the things I think sort of intuitively about this is that part of what we do, and others do in other places, but we do, is that we've tried harder than a lot of other places to raise the bar, to do more. And what inevitably happens when you do that is that people expect more, and that has its own challenge to it. But given that we are where we are in our respective roles, and it's just a burden, as it should be, on the administration and on council, to having had asked for resources to care and do more than celebrate once the initiative is passed, the issue was passed. So we want to work with you and with everyone else who cares about these issues, whether they're in county government or wherever they are. And so if we seem aggressive at some points, it's because we want to help, and so we feel obligated, having asked people for funds, to do our best to be part of this. And so again, we appreciate everything that you've done, and we're here to help.
Thank you. I mean, truly, my staff and I see this as an opportunity. We're a hard system to understand. We believe in transparency. We believe we are responsible to this community, that we are responsible. And so this isn't the best way to spend a day, but honestly, I think more people really understanding the complexity of the work we do will cause folks to want to maybe be a part of it in a different way and to really understand that. So truly, we are public servants just like you guys are, and it is our responsibility to be accountable to the public. So we do understand that. But thank you.
Yes, and I just wanted to follow up. This is not an inquiry, you pass or fail type of thing. I mean, this is an important topic, like you stated, for the community, for this county. It's one of our major missions, is when we all over United States, that is the county's mission is to take in children and to be parents to them until their parents get better to be able to take care of their own children. So it's a heavy responsibility, and we all know we each have our own different parenting styles. So I do think I like the part about the team decision-making versus one person making a determination on a case just for the simple fact of the different ideas. I do like that. I do, as Councilman Miller, see some weaknesses and some things, some recommendations that will definitely come from this, but we're not trying to talk about those now. Right now, we just want to have an open dialogue for the full presentation, and then maybe we will bring some of those to your attention at the end of the series. But one request I would ask that, and I know you're still working on this, but if you could provide at the next hearing the list of dates for all the community
Yes.
listening tours, that
Yes.
will be appreciated, so the
We will.
community can know about those.
Okay.
Thank you very much for your time and attention today. Any other public comment?
Yes, Davina and Tierra Jones.
All right.
Hello again, everybody. We want to really thank you all for holding this hearing today. Thank you all again for coming out and being transparent with us. We do appreciate it. And while there are changes being talked about, we all know there's still work to be done. And just having this forum is great. One thing that I heard was that when things happen, they're teachable moments. Just for me, as a family member of Tanasia McLeod, our teachable moment shouldn't come at the risk of our children. Right now, we have an opportunity while we have our children safe and while we have this forum to actually make these changes. Mr. Miller mentioned the 6 occasions where errors could occur. And the director stated that the public opinion affects the caseworker's moral. Speaking on behalf of the family, you know, we reached out to CPS. You all know our story. We've talked to you all. That makes the public more keen on what's wrong. When we know we actually have tried, we've done all the steps, we've called, and things don't happen. So we know there's great social workers. Majority of them are going to be great. We know that, and we really do appreciate the work that they do. We just ask that when we do see that there is an issue, as we've seen with the cases, I won't list them because we all know them already. As we've seen that there are issues, one bad apple can spoil that whole bunch. We would all like to believe that every one of us are great at what we do. But at the end of the day, mistakes happen, things happen. As a organization, we just have to move forward and make sure it doesn't happen again. One thing that when Ms. Brown asked about resources, and at first it was no resources. You spoke about the typing. Just in my mind, when I sat back there, I thought, well, if we have issues with these caseworkers not being able to type as quick, get as much done, what about the voice-to-text devices that help get that done? They can do that sitting somewhere, driving, anything. That could alleviate something. So that's just from me.
Thank you.
Anyone else?
Yes, one last speaker, Ms. Donna Walker Brown. I think she left.
All right. We will continue. Like I stated earlier, this is the first of 2 series. We will be back next week, same time at 1 p.m. Thank you. Meeting adjourned.